Hi, my name is John Humphrey, registered nurse. In this recording, I will be discussing evidence-based care for gender dysphoria with an emphasis on remote collaboration with our interdisciplinary team. This case I will present involves a transgendered male who has limited access to healthcare services. The patient seeks hormonal therapy and surgical intervention for his diagnosis of gender dysphoria. I will also provide an overview of gender dysphoria and its impact on the patient in this case study. According to the Diagnostics and Statistical Manual of Mental Disorders, gender dysphoria is a psychological discomfort that occurs when a person's gender identity does not correlate with the sex they were assigned at birth. People with gender dysphoria potentially face challenges in their relationship with family, peers, and others in society. These challenges can contribute to feelings of depression, low self-worth, and high risk of substance abuse and self-harm. A little bit of background on this case study. In the Villa Health case study, we have a 25-year-old transgender male patient who has restricted access to healthcare. Post-evaluation by his healthcare provider, he was diagnosed with gender dysphoria. Following the diagnosis, the patient has shown interest in undergoing hormone therapy and plans on pursuing surgical treatment. To address his needs, we would assemble an interdisciplinary healthcare team to collaborate on his care. Each professional healthcare personnel will contribute their expertise to ensure a comprehensive approach to treatment. This team includes the patient's primary care physician, Dr. Smith, in the case study, registered nurses, psychiatrists, endocrinologists, and surgeons. In the care plan for this case scenario or case study, we're working with the 25-year-old transgender male who feels he's ready to begin hormone therapy and surgical interventions for his gender dysphoria. After consulting with the experienced interdisciplinary team of healthcare professionals, it has been recommended that a more thorough mental health evaluation be conducted before starting treatment to ensure a comprehensive assessment and confirm the diagnosis that was given to the patient. A review of the patient's complete medical history is essential. This review should include details about family, social relationships, and any history of childhood trauma, education, and academic performance, substance use or abuse, legal history, and past suicide attempt history. The evaluation process should also involve individual therapy and family counseling to explore the patient's feelings, address any concerns, and provide an unbiased emotional support for the patient. Hormonal treatment is a crucial step before considering surgical intervention, known as gender-affirming hormone therapy. This treatment is necessary to help align the patient's physical appearance with their gender identity. For the patient to begin hormone therapy, they must complete the 4 criteria outlined by the World Professional Association for Transgender Health. These criteria include consistent and documented gender incongruence, the mental capacity to make informed decisions, legal age, the completion of all required mental health evaluations. Additionally, the patient must undergo screening for any pre-existing or family medical history conditions that could contraindicate hormone therapy, such as like cardiovascular history, thrombolytic disorders, hormone-sensitive cancers, dyslipidemia, and epilepsies. Some of the evidence-based practice nursing that we researched through this case study, we used the Johns Hopkins nursing evidence-based practice model. So some of the questions they would ask based on it is, how can our interdisciplinary team collaborate to ensure this patient is fully prepared and meets all requirements to begin hormone therapy and surgical intervention for gender dysphoria? Some of the evidence: the patient has a confirmed diagnosis of gender dysphoria. Our team, which includes the psychiatrists, endocrinologists, surgeons, and nurses, has to start conducting individual assessments to evaluate whether the patient is ready or not to begin treatment. However, the team has collectively agreed that a more thorough evaluation is needed before treatment can begin. The treatment plan would involve ongoing mental health assessments by a psychiatrist to monitor the patient's mental stability. Additionally, blood tests and other screens would be taken into consideration to look for any other underlying medical conditions. Once these evaluations are complete and the patient is deemed ready, hormone therapy would be initiated to assist with the transition process. Surgical intervention would be considered as a final step once the patient is sufficiently prepared. When collaborating with healthcare team via telemedicine, the healthcare plan is improved by the ability of each discipline and to offer consultations from different locations. Developing effective interventions would involve a thorough review of all available data to create a comprehensive care plan for the patient. One potential challenge is the need for an in-person assessment by nurses and surgeons, which may require some travel for the patient to different locations where these evaluations can occur. Despite this, the patient can still receive high-quality care, knowing that their healthcare team is working together remotely to develop the best possible plan of care for them.